In this video, we'll talk a bit about sympathetic neurotransmitters, and we'll continue on talking about a little bit about receptors. Now, we're going to really focus in on, one of the reasons why we should be interested in knowing this material. Well, first of all, the autonomic nervous system is really one of the two key systems that controls homeostasis. And the other reason is that since it is such a important system for regulating many parts of our body, this is really where a lot of pharmaceutical agents are aimed in terms of their action. So let's spend a few minutes and just talk about pharmacology and the sympathetic nervous system receptors. So not surprisingly, when we look at the sympathetic nervous system and parasympathetic also, that these receptors really are targets for medication and therapies for many different types of diseases. And, two examples would be asthma and hypertension, but the list is quite extensive. And the existence of these different subtypes of sympathetic nervous system receptors has allowed the pharmaceutical industry to design drugs that can target these different types of receptors and hopefully have beneficial effects. So, a couple terms that we should look at in that most drugs targeting the sympathetic nervous system work in one of two ways. And here's two important terms. Antagonist. Well, what's an antagonist? When we talk about a drug being an antagonist, it blocks the receptor and prevents a norepinephrine from binding to it. So it basically inhibits the ability of that neurotransmitter from interacting with the receptor, and therefore it would block that action. So we have the antagonists, and then also when we're talking about antagonists, the next one is the agonists. Let's do that, agonists. And they bind to the receptor and they mimic the effect of the neurotransmitter, or let's say in this case, norepinephrine. So in the world of pharmacology, you often hear about drugs being either antagonists or agonists. Now, we could have a look at just some examples. Now, this is just more FYI. The first, what we've talked to this point, you should know those terms, agonist, antagonist. But I just wanted to give you some examples which are more FYI. But let's take a few minutes and run through them. So things like alpha-1 blockers, they're antagonists, and they bind to the alpha-1 receptors, not surprisingly. And really, this is about smooth muscle cells in the blood vessel linings. And what does this do? Well, it blocks the action of norepinephrine, and it prevents a blood vessel from constricting. And of course, if blood vessels constrict, then blood pressure would go up, because the amount of blood in a smaller container, pressure goes up. So this would lower the action of these blockers, would lower blood pressure. And yes, it's one of the ways to treat hypertension. Another example is some alpha-1 blockers are used to relax smooth muscle in the prostate and can help with a condition known as benign prostatic hyperplasia. When we're looking at alpha-2 agonists, what happens is they bind to the presynaptic alpha-2 receptors and activate them. And we get a decrease in both preganglionic and postganglionic sympathetic neurons. And these type of agonists can you can use them to treat for things like hypertension. Now, here's another big group of the beta blockers. As I said, I wouldn't hold you responsible for this pharmacology, but I think it's worth just spend a few minutes as an FYI. As I said, you should know those two terms, agonist and antagonist, and the general concept of the first bit of the video. So the beta blockers, the antagonists bind onto the beta-1 receptors on the heart, and they decrease both the rate and the force of contraction. And of course, if I'm decreasing the beats per minute and the amount of blood leaving the heart with each heartbeat, then I'm going to decrease the cardiac output. And when I decrease cardiac output, it would have a role in basically decreasing blood pressure, aka hypertension if it's excessive. Another example would be beta 2 agonists. And they bind on, not surprisingly, to the beta 2 receptors, in this case in the smooth muscle of the bronchioles. And they cause bronchial dilation. So if I dilate those bronchioles, the lumen gets bigger and the resistance to airflow goes down. And that would encourage the easier transport of air in and out of the lungs. And it's often used to treat things like asthma. Okay, I just want to talk about that and introduce the concept of pharmacology and give some sense as to why knowing your autonomic nervous system is a really important first step to eventually learning pharmacology.